The Mulligan concept, principles of taping. In the application of taping and manual therapy techniques, practitioners acknowledge that contraindications to treatment exist and should be respected at all times. Mulligan taping techniques should never cause pain and must improve function. Practitioners choosing to make use of Mulligan taping techniques must acknowledge and abide by the fundamental principles of manual therapy. Specific to the application of the Mulligan concept in clinical practice, the following principles of taping have been established. 1. During assessment, identify one or more comparable signs as described by Maitland. These signs may include loss of joint movement, pain associated with movement, or pain associated with specific functional activities. The comparable sign should be used to reassess the efficacy of the taping technique. 2. Passive accessory joint mobilization is applied following the principles of Kaltenborn. This accessory glide must be pain-free. The pain-free passive accessory joint glide is used to determine the direction of taping. 3. Passive repositioning of soft tissue and/or muscle is applied to allow for pain-free muscle contraction or limb movement. 4. While sustaining the accessory joint glide or soft tissue repositioning, the patient is requested to perform the comparable sign. The comparable sign should now be significantly improved and/or absent. Failure to improve the comparable sign indicates that the practitioner has not found the correct treatment plane for applying tape or the technique is not indicated. 5. Continuously monitor the patient's reaction or comparable sign to ensure movement is pain-free with the use of tape. Utilizing knowledge of joint arthrology, soft tissue dysfunction, and clinical reasoning, the practitioner investigates various combinations of angle and vigor of pull with the tape to find the correct treatment. 6. The previously restricted and/or painful motion or activity is repeated following application of the tape. Further functional gains are expected with the application of tape. 7. Additional gains may be realized through the application of mobilization with movement, MWM, and appropriate exercise interventions. 8. Skin reaction to tape must be closely monitored, and pre-application measures such as cleaning or use of protectant may be necessary to avoid adverse reactions. 9. Self-treatment with tape is often possible using principles of MWM. In conclusion, the techniques presented in this application have been developed exclusively as support material to postgraduate courses taught by a credentialed Mulligan concept teacher. The skill of proper patient handling and confident manual therapy procedures can only be achieved through individualized instruction and diligent practice. Northeast Seminars and the MCTA strongly discourages the use of any taping technique that has not been learned in an appropriate individualized mentoring relationship and takes no responsibility for any harm or medical misadventure. Manual therapy practitioners seeking to expand from a basic recipe treatment format to an analytical problem-solving approach based on a solid foundation of anatomy, arthrology, and biomechanics will find the Mulligan concept rewarding to patients under their care and to their own professional development. Additional information on Mulligan concept instructional courses and valuable manual therapy links are available at www.bmulligan.com and neseminars.com.